morning, Jim. My name is Megan. I'll be the physical therapist working with you today. So to start off, we're just going to run through some history questions regarding your wound specifically and your overall health before we actually get started with an evaluation. Is that okay? Okay. So when did you first notice this wound? Okay. Did you ever, have you ever had a wound like this before? And if so, how did you treat it? And is the wound painful? And can you give me on a scale from 0 to 10, 10 being the worst imaginable pain and 0 being nothing? Are you currently putting any medications or topicals on this wound? Do you have any allergies to medications? And what kind of shoes do you wear on a daily basis? Okay, so I see in your chart here that you have type 2 diabetes, you had a kidney transplant, and have a history of hamartose. So essentially, diabetes will systemically slow blood flow and decrease the amount of nutrients being delivered to the body, especially in wounds. Infection is very common in patients with diabetes, and with Jim being extremely immunocompromised from his kidney transplant and medications, the chance of infection increases even more. Along with diabetes, there can be a loss of sensation, most commonly in the feet. This is due to a protective loss. Can lead to prolonged pressure on his feet due to the inability to recognize the need for a change in position. Unless there are daily skin checks, a wound can go unnoticed for a significant amount of time. Jim is also on a few medications for high blood pressure. It is not stated in his medical history to have hypertension, but since he's being treated with these medications, it is possible to assume they're diminishing his ability to heal, as well as limited circulation of oxygenated blood and nutrients to the healing tissues. Okay, Jim, I see, looking at your current medications, that you're currently on insulin, losatran, cyclosporine, and hydrochlorothiazide. Is this correct? Okay, insulin can play a role in increasing the speed of wound healing when used topically, but in this case, because it's used systemically, it's being used to stabilize blood glucose levels, so it only aids in the unstable progression of diabetes, which can hinder the wound healing process. Hydrochlorothiazide is is a diuretic and is used to treat high blood pressure as well. This medication can impede healing by expelling too much water and salt, allowing the blood to be more viscous and decrease the blood flow to the tissues. Tissues also need to be hydrated in order to heal, and if the body is constantly losing water due to diuretics, there's less water for healing, as it'll go to more important tissues such as the brain, heart, and stomach. Losatran, again, is another high blood pressure medication, but has been shown to actually accelerate the wound healing process in patients with diabetes. Cyclosporine is the immunosuppressant drug that's generally used post-transplant, as you have here with a kidney transplant. This drug will suppress the immune system to stall and hinder the wound healing by limiting white blood cells, macrophages, and neutrophils in circulation. It introduces the risk for an opportunistic infection. Okay, so Jim, we're gonna look at your functional mobility, your occupation, and your lifestyle habits. So Jim is a construction worker on his feet for 10 to 12 hours at work. Walking into the clinic, he had a slight limp. He has been trying to be more active as the days are longer and it's nicer out. He states he mostly swims and bikes right now on the weekends because he's too tired to do so after work. He discovered the wound last weekend when he was drying his foot off after a pool session. Prior to the wound, the patient states he had no difficulty at work other than being mentally and physically tired from working 10 to 12 hours, but that was just normal. He doesn't feel much pain in the foot when he walks, but his wife pointed out that he was walking differently on one of their day trips outdoors. So his functional status can impact some future treatments. So while it's great he desires to be more active than just working, it can affect his healing times as he's spending more time on his feet. He is motivated to heal the wound and take care of it. He states he has been taking care of his diabetes without an issue now and will do the daily skin routine checks to prevent any more ulcers from forming. This is a patient who is on his feet all day, and although he is motivated, being in heavy boots with pressure on the feet daily, there is an added stress to the tissues and conscious recognition to adjust the weight on his foot throughout the day. The constant stress on the foot can inhibit wounds from healing and create new wounds. Okay, Jim, so now what we're gonna do is I'm just gonna go through a few systems, or we call our systems review, just to check kind of the whole body versus just the wound. So first we're gonna start with your cardiovascular system. So I'm just gonna take your blood pressure and your heart rate. Okay, those are normal. We're looking for, an increase in blood pressure or an increase in the heart rate. It could be due to nerves or hypertension. Next, I'm gonna look at your pulmonary system. So I'm just gonna put this on your finger and we're gonna take your pulse ox and I'm gonna record how much you're breathing. So just try and breathe normally. I'm gonna keep talking to you while we're doing this. Okay, everything's normal there. So a normal pulse ox is anything greater than 95%. And a normal respiratory rate is 12 to 20 breaths per minute. So then in the musculoskeletal system, so I'm just gonna check your strength. Overall, so we're gonna check your arms, your legs, everything just to see kind of where you're at. And I can see here that your lower extremity strength is a little bit decreased due to some muscle atrophy and general weakness, which is normal with aging, as well as diabetes. So for the neuromuscular system, we're gonna do something called a 2-point discrimination test. And essentially what I'm gonna do is I have 2 points here. And I'm gonna touch them just around your foot, around your ankle, and a little bit up your calf just to see where you can feel things. So I'm either gonna do 1 point or 2, and I want you just to tell me what you feel and where. Okay, so we're gonna do, okay, great, 2 points. 2 points, okay. Nothing, okay. Okay, great, good job with that. So you do have a little bit of loss of sensation with that test, and you're unable to discriminate between 1 point and 2 points. So the next one I'm gonna use is a monofilament test. So I have my monofilament here. It's a 10 gram. And so what I'm gonna do is I'm just gonna poke around in different areas of your foot to see if you can feel anything, and just tell me where you do and when. I'm just gonna apply pressure. Okay, great. So you do again have a loss of the protective sensation because you were only able to feel 2 of the points instead of all 4. Okay, so we're good with that. The GI, so we're going to talk about some GI stuff. So can you walk me through your daily food intake? And okay, listening to that, there's a possibility of a little bit of malnutrition. So you're eating enough, but not the correct things. And your water intake is not very high. And last thing we're gonna do is your integumentary system. So I'm just gonna look at the skin kind of all around the area. I'm gonna look at your wound specifically after, but we're gonna do just kind of an all over skin check. So the surrounding skin on the plantar surface of the foot is pretty dry and calloused, and it's very thick, likely due to hyperkeratosis. And then around the toes is pretty hard, calloused, and rough skin. I noticed your skin is pretty dry and not as moisturized as it should be. Okay, Jim, now what we're gonna do is we're gonna look at the wound itself. So I'm just gonna take note of location, the size of it, and any other characteristics about the wound. So first off, we're gonna look at the location. So we see it's on the plantar aspect of your foot here. So that just means the bottom of your right foot. And it looks like we're over the 2nd, 3rd, and 4th metatarsal heads. Okay, we're gonna take just a quick measurement. I'm just gonna see how big the wound is. So we're gonna go from wound edge to wound edge. I'm gonna do your length times your width. Okay, so I'm gonna do length here. Starting is 1 centimeter, and the width is 1.5 centimeters, giving you a total surface area of the wound of 1.5 centimeters. All right, now looking at the wound bed, it appears to be slightly moist there in the middle, shiny, but it's a pale tissue there are some slightly red, darker red edges between our 12 o'clock here and the 9 o'clock. There's some dark red right on the edge, as well as between 1 o'clock and 4 o'clock. There's another section of a little bit darker red granulation tissue. Now looking at the wound edges, they're intact. They're even and circular, likely due to peripheral artery disease. It kind of looks like a punched out hole, which is what this looks like. And now looking at the para-wound area, as you can see here, they're white because they're moist and you did have some exudate coming out. When we took the bandage off, it looks like it could be slightly macerated or the beginning of a maceration around the edges here. While the extended peri-wound area, right around this area, is dry and calloused. but immediately around the wound is like a light pink flesh colored. You can tell that there's some thickness here in callousing in the great toe, as well as there's some thickness around the area of the tissue. So the exudate that came out is kind of a thick, opaque, which we want to keep an eye on because that could be due to an infection, and it was moderate in quantity. So looking at this ulcer, I'm going to say that this is a neuropathic ulcer, likely due to your history of diabetes and the punched out wound edges and everything we're just kind of seeing here, as well as your history questions.